Okay, it looks like everyone's connected. I think Annette might still be trying to connect. So hopefully that goes through, but we have a pretty small, intimate group today. Thanks for joining us. My name, Lisa, you can go ahead and share the slides. Lisa is working with me at Health Literacy Media. She's going to be working with the slides today. But my name is Megan Rooney. I am with Health Literacy Media, and many of you have attended. I see some familiar faces, but we are working with the Kansas City Health Department to develop a series of trainings as well as many different materials and videos covering an array of topics around health literacy and COVID. So today's training is going to be a quick 15 minutes. We have 13 minutes now for how to use plain language. So we're going to be moving pretty quickly. We're just going to go over 3 main points. At the end, we will place a survey in the chat if you could fill that out. So Lisa, you can move on forward. Okay, camera, use the chat if needed. Like I said, there'll be a survey and we'll also send a quick little summary out through email. So let's get started. What is health literacy? Why is it important? Many of you already know this. This is a recap for you. There's kind of 2 different types of health literacy. There's personal, there's organizational. Personal, we all know, is the degree to which an individual has to find, understand, and use information. But an important addition is the addition of organizational health literacy. So recognizing that organizations and providers also play a role, and how can they equitably enable individuals to find that information and use it. We have limited health literacy in the US. 93 million American adults lack health literacy skills to read and understand complex information, to calculate dosage and timing, to make decisions about risk, to manage a chronic condition, and also to understand and act on a diagnosis. And why is health literacy important? It's clear for all of these reasons, but there's a quick little story. Lisa, if you move forward, yeah. So for example, a doctor might say, we cannot use a local treatment to treat your wound. It might sound simple enough, but to a patient, they might think that local, regional, local, global, they have to travel somewhere to treat their wound. However, that's not what the speaker meant. So words matter, language is important. So let's move into the actual skills. And because this is a training for providers and it's really quick, there's less interaction, a little bit more just education. So, bear with us, but also feel free to chat us up and ask questions. So plain language is communication your audience can understand the first time they read or hear it. So an instruction to a patient might be, the drug should be taken as instructed until symptoms resolve. Sounds simple enough. Again, however, there's problems with this. So a revision might be, take this medicine every night right before bed until you no longer have X symptoms. This usually takes about, and then give the time frame. This adds specificity, it puts it in active voice, and it gives the patient more information. Well, the top one uses passive voice and it's vague, and there's a lot of room for misinterpretation. So, avoiding jargon. So here are just some examples of jargon words in healthcare. And I'm always surprised, or I'm always just, not surprised, but always interested to hear from people what words they use and that they think are jargon or don't think are jargon. And so a good rule of thumb that we always use is, if you're questioning whether a term is jargon or not, is this clear to people? Will my patients understand this? It's a pretty good indication that there might be an issue with it. So to be on the safe side, always questioning the terms you're using, even things we use commonly like inflammation. there's a lot of misunderstanding around inflammation. So what does that really mean? Using words like cardiac, edema, these are all words that providers and healthcare professionals are trained to use. However, they have to translate it when they're working with patients. So we have a quick little activity. Feel free to chat us your replacements for these words. So abstain from, what's a quick little revision or replacement? How could you say that in a more simple way? Don't, right? It can be that simple. Don't or do not. Stop. Stop is another way, depending on your context. Administer. I see this a lot in the work that we do. We revise and edit and develop a lot of content for different health topics. I see administer a lot. Yeah, just give. Annual. Seems kind of like a simple word, but do people say annual? Maybe in certain contexts, but not day to day. Yearly, every year. Exactly. Contusion. Pretty clinical word. Yeah, a bruise. I mean, if you tell someone they have a contusion, they might get very, very concerned. However, it's just a bruise. And it says boo-boo. Sure, depending on your audience. We say boo-boo a lot in my house with my tiny kids. Inflammation is a tricky one. Red or swollen, swelling, exactly. Swelling, while not maybe like clinically accurate, to a patient, what's the patient experience? To a patient, it just means it's irritated, it's swelling, it's red, it's your body's way of, trying to heal something or react to something. Chronic. Chronic. Any ideas there? Long-term, exactly. Long-term, long-lasting, even if it takes you more words, something that lasts a long time, or something that you will be managing the rest of your life. Just any way to explain that. Ongoing is another good one. Hypertension. I remember a story where a patient read that and thought it meant like tense, stressed out, a lot of stress. High blood pressure, exactly. Lesion. A wound, a sore. Yep, exactly. Sutures. Just another way of saying stitches, exactly. And then I put this one in here because my pediatrician said this to me the other day, and I thought, man, if I didn't kind of work in health communication, I wouldn't know what this word is, but febrile. Weak. Have a fever. Yeah, that's what they meant. They said, as long as they're not febrile. A fever, and being specific, what is a fever? For kids, it's like a certain number. I think it's 101.4 or something like that. So being really specific. Okay, moving right along. Defining terms. So sometimes a term is important for patients to know. You don't want to awkwardly replace words that they actually might hear or might need to know. So a tremor, that's a word for something. So Lisa, you can just go ahead and click through these for time's sake. But, shaking, such as in your hands. Gestational diabetes, well, that's an important term to know. That's diabetes when you're pregnant. Out-of-pocket costs, very important term to know. You're going to hear that in your health insurance guides and your information. So you need to know, you need to have the definition. So, determining, is this a word I can just easily replace, or is this a word I think this patient needs to know? And I want to make sure it's clear. So that's jargon. On to our second strategy here, keeping it simple. The main point here is choosing 2 to 3 of your most important points. There's research into human memory that shows that people cannot remember more than 3 to 5 pieces of information, 7 at most. And there's a reason phone numbers are 7 digits long. People cannot remember more than 7 on average, but definitely 3 to 5 is where you see like memory start to drop off. And so trying to keep it between 2 to 3 items is an important little fact to keep in the back of your head. So an example of that, what's the most important information? And you can move forward, Lisa. So you're going to talk to a patient about COVID, what they should do to cope with COVID. There's a lot they should do. There's a huge list of items that are important for them to know. However, if you're working with a patient, someone in the community, you really just want them to know the main points. So what you got to think to yourself, 2 to 3. 2 to 3 is my number. What are the 2 to 3 most important points here that I really want them to know to be safe? And then maybe you could provide them with a handout or a website to learn more. So for us, the ones we picked were stay home and away from others, wear a mask, call 911. And you'll see that in the first bullet, we gave more information, being, again, really specific. You want to stay at home for at least 5 days after your test. And here's what that means. Staying in separate spaces, separate bathrooms, utensils. This is called isolation. So not just saying stay home, but giving them that really specific action item, which leads us to our very last tip here, give specific action steps. So there's kind of 3 important things you always want to include when you're giving an action step. That's what should they do, how should they do it, and why should they do it? And those 3 items are in green right there. And so trying to keep your action items to those 3, kind of keep the scope to those 3 points, and including that 3rd one to support motivation. So an example of a vague action step might be, Lisa, yep, get enough exercise to stay healthy. Okay, get enough exercise. And why should I exercise? Just to stay healthy? Lots of things I should do to stay healthy. Vague, there's no motivation in here. There's nothing to support the patient actually taking the action. So a revision to this might be, try to be active for at least 30 minutes a day, 5 days a week. For example, giving a really specific example, 15 minutes 2 times a day. And the reason this is because this will help blood flow and keep your blood pressure lower. So giving people that important why will help increase motivation. So we've got 1 minute left. Here's just a quick summary of our tips on the next slide. Use plain language, give specific action steps, keeping it simple, focusing on the 2 to 3 most important points. We have a minute if anyone has any other questions. And you'll see that this is the first in a series of 4. Our next training is going to be a teach back training, and that is going to be on January 12th. Feel free to use the last minute for questions, but if not, thank you all for joining us for this lightning round, using plain language with your clients and with your patients.